Hello, my name is Victoria. I'm with the Regis College Epidemiology program. Today we are here to talk about asthma and smoking. Asthma is classified as a chronic respiratory disease that affects both your airways and your lungs and is associated with symptoms including coughing, shortness of breath, chest tightness, and wheezing. At this time, there is no known cure for asthma, only medication that we can take to temporarily alleviate symptoms. Asthma is classified as a preventable disease by the CDC, and we should be taking active measures to prevent and decrease the occurrence of asthma attacks in individuals. Those with asthma should especially avoid secondhand smoke because smoke inhalation contains more than 7,000 chemicals, hundreds of which are toxic, and about 70 of those are considered carcinogenic. With that, a 2008 study did find that there is sufficient evidence that secondhand smoke increases wheezing within young children and can lead to greater disease symptoms in childhood throughout adulthood. A few methods to reduce this exposure include separating smokers from non-smokers, ventilation, air purifiers, and air filters. The 2007 National Asthma Education and Prevention Program suggests that there is strong evidence that smoking cessation is the best way to change behaviors, especially in households that contain young children and asthmatic individuals, because just advocating for the separation of smokers and non-smokers has been found not to be beneficial in the long term. With smoking cessation, it is very hard to go through that because smoking is habitual, it's addictive, it affects your social groups, and it does come with a fear of the unknown. With that, a really good study that was conducted in 2016 by Castonguay, Filler, and Pitts suggests that cues to action are the main drivers to seeking treatment. And they emphasize the importance of the family and friends to educate them and promote them to provide resources to smoking individuals to help them quit and kind of be there by their side throughout it. Of course, there are plenty of programs in place already that kind of help with smoking cessation. A major one is the CDC's Tips from Former Smokers, in which they worked with the community to include tips, questions, and actual experiences from people who have been affected by the negative health effects of smoking. With that, they provide evidence that smoking does kill more than 480,000 Americans per year, and with every American person who dies from smoking, another 30 lives with chronic smoking-related illnesses. Fortunately, the CDC's program has had a very positive impact with the data that they've collected over time, starting from 2012 through 2018. Of the 16.4 million people who were recorded to attempt to try to stop smoking, about 1 million did succeed, which is significant. And of course, they do have a hotline that is available if anybody needs it. It is the 1-800-QUIT-NOW, which is super simple to remember. Another thing that I would also like to discuss is that prevention is very effective and very important, because if we can get to the point where cessation is not needed, it won't be as difficult to stop those behaviors and change health outcomes for asthmatic people. With that, a really good talk that was done in 2013 by SAMHSA, it was in relation to alcohol addiction, but in reference to all sorts of addictions, they offer that prevention is the greatest opportunity for health. And it is the most cost-effective way to reduce use and consequences and empowers people to make better choices. If you have any questions, please feel free to reach out, and thank you so much for your time.